Donna G asks, how often do I need the shingles vaccine and how long should I wait to get it after being infected?
Great question. So the shingles vaccine generally recommended for those over the age of 50. It's in 2 doses between 2 to 6 months apart. You really only need 1 dose. However, for patients who might be immune compromised or have other risks, there might be more that's recommended. And in terms of how long after the infection, in general for vaccines, we typically say you wait until you fully recover from that infection before you can get the vaccine, but there's no required space between your infection and the vaccination.
Your prescription for wellness?
Since so many people are suffering from these gastrointestinal illnesses, I'll be in the ER later today, likely seeing patients suffering from them. I wanted to give some helpful instruction on what to do as you're easing back out of those symptoms into a normal diet. So here are some basic tips that you should stick with. The number one, you want to make sure that you avoid solid foods. You want to keep your diet as bland as possible. We call it the BRAT diet. It stands for bananas, rice, applesauce, toast. Everyone kind of knows that, but you want to increase starchy foods. And then also start with clear liquids. Teas like chamomile, ginger, and even sports drinks can be helpful to replenish that hydration. And then also making sure that you're gradually adding low fiber foods. The fiber is what might increase your symptoms. Another tip here is that studies have shown empty stomachs are more likely to have symptoms of nausea. So you want to eat food, but in small parts, keeping a little bit and also staying upright to decrease your risk of heartburn. And then think about over-the-counter medications. Medications like ibuprofen, for example, can increase your risk of stomach discomfort and increase those symptoms. So you want to avoid them as you're recovering from that gastrointestinal illness.
All important to know.
I just survived stomach bug in my house, my 3-year-old, and I know Jess, our producer for the medical segments, she's dealing with a stomach bug.
We all get nailed with it at some point.
Yeah, I know. You got to be careful.
Good luck, Jess. We love you.
Dr. D, thank you. We love you as well. And we do love to hear from you. So please hit us up on Instagram with whatever medical questions you have. That's at ABCGMA3.